wait.
Yes.
I'm sure these guys want to know. I'm sure these guys want to know. Did you get a BBL?
Well, I mean. What's up, guys? My name is Dr. Dlamini. I'm from AJ Plastic Surgery Center, and today is the debut of African
Contoured
Podcast.
Amazing, guys. And my name is Dr. Thomas, also from AJ Plastic Surgery. Let's break some legs.
Awesome. So, today we're just going to be addressing a couple of questions you've asked before, questions you may be afraid to ask, or questions that you are still about to ask.
Guys, let's debunk the myths on Brazilian butt lifts.
Yes, so today we'll be talking about a BBL, or should it be called African butt lift?
I mean, Africans have really nice tushes, but the Brazilians have it all.
Are you sure?
Yeah,
African is...
Maybe the Brazilians will become Africans. Maybe
we'll change it. Let it become an ABL.
But for now, Brazilian, guys.
Brazilian butt lift. Let's go.
Amazing.
So, first question. What problem does a BBL solve?
So the first thing you need to appreciate is that for most of the patients who are going to come for Brazilian butt lifts, most of the time we're just trying to augment the natural appearing, amazing beautifulness of these ladies, where we just want to add a bit of size and contour a bit of shapes, so that the bum bum looks, better than actually how it is.
Yeah.
So that's the main thing, most of the patients usually come from.
Yeah.
Size and shape of their tushy.
Yeah, essentially. So you want the butt to be like nice, lifted and round.
Yes,
but there are some little issues. Like when a woman is standing, there's like these little
those dips, yeah?
Yeah, those little dips, so hip dips on the sides. And then you might also find like on the actual butt itself, it has like a few
holes,
little
kind of
dimple
things.
Okay. So BBL can actually address that as well, because you can fill those areas so that you kind of have like, that nice ballooning.
Exactly, nicely perfect bum bum.
Yeah,
amazing.
So essentially that's it.
Yes.
Another question, does BBL smell?
Guys, no. Why should the BBL smell? It's just like any other surgical procedure. No surgical procedure smell. In fact, post BBL usually help our patients doing some of massage sessions.
Yeah.
And these massage sessions, they usually
they
massage
have, like,
with
eucalyptus
oil, aloe vera,
vera.
and they smell beautiful after the massage. But generally, no surgical procedure should be able to smell. Therefore, these patients ideally don't smell.
Yeah, ideally you don't smell.
If
anything, you smell better.
Exactly. They smell better after coming for a BBL, guys. Let's get BBLs.
Yes. So, what is the truth about BBL recovery?
So, when you're doing a BBL, remember principally is that you're going to be dealing with two areas that are healing. For us to be able to add the fat on the bum bum, we need to make really tiny, small incisions around the area of the bum bum. Okay? Because that's the point where we're going to enter and, deposit a bit of fat just beneath the skin. But also, primarily, what is very important is that once you've deposited the fat, this fat needs to settle. Therefore, please, guys, let the tushy rest. Okay, so no pressure, guys, no pressure on the bum bum. And the reason is actually quite scientific, because when you're adding pressure on the bum bum, first things first is that you can, kill a bit of the fat cells. Therefore, the, expectation that you had for the big bum bum might not occur. Okay?
Yeah. So essentially, I feel like the most challenging thing after a BBL is like, let the tushy rest.
Let the tushy
essentially,
rest.
what he's saying is don't put pressure on the tushy. So you might hear us say, oh no, don't sit, So you probably can't sit for long hours, you can't sit for a long period of time. Or you could buy like a BBL pillow, which you can actually sit on.
Definitely.
Yeah, but essentially, the recovery period is smooth. Remember, BBL is a minimally invasive procedure.
Guys.
The incisions are really tiny.
Exactly, guys.
So yeah, I think recovery is pretty good.
Let's get BBL, guys.
So, yes, we love BBLs.
Definitely, we love BBLs. So I'm going to go to the next segment, okay? Let's continue. The momentum. The momentum is amazing,
Yes.
So are the results of Brazilian butt lifts permanent?
Very good question. So essentially, yes. You can go for years after BBL and you go on looking amazing. But you need to remember, it's also about lifestyle. How are you?
You are what you eat. Exactly. Principally.
So you could gain weight, you could lose weight. So that could change the aesthetic of what the BBL initially looked like.
Definitely.
But if you're like continuing, like you're doing normal diet, you're doing exercise, it should be fine.
And that's important, guys, because what we do is that for patients who have BBL, usually couple them with the best nutritional support that they can be able to maintain the amazing, beautiful results that they've gotten out of these BBL procedures, okay?
Yeah. And remember to do those squats at
the gym. Do them squats, guys. Do them squats. Nice. So I'm going to go on to the next question.
Yes.
Pretty interesting question. Intense question. So they're asking, what happens to the fat? You know that fat? The fat that you add at the bum bum?
Yeah.
So these guys want to know. The audience wants to know, what happens to this fat when you're doing this procedure?
That's a very good question. So, with BBL, there's a certain process that we go through. So first we harvest the fat from you, and then we do something called fat treating. So essentially we're washing the fat, we're cleaning it nicely, and then we also add antibiotics onto it before we transfer it.
To prevent those infections, guys. We don't want those infections. Exactly.
So then after that, it's just injected into your body. It's just like being pushed through a syringe. Or like we have like those high-powered machines to like push it nicely.
Push in the fat. We use the term infiltration, guys. Word of the day, infiltration. Okay, guys, we infiltrate the fat into the subcutaneous spaces or the space just beneath the skin.
So it's pretty simple. I mean, when you think about it or when you process it, it's pretty simple.
And it's a very safe procedure, guys. Don't be scared to do it, okay?
Yes.
Nice. Next question. How soon can one take a shower after Brazilian butt lift?
Oh, the good thing, like we said, it's minimally invasive.
Exactly.
The incision is so tiny. It's pretty much like you have a cut on your finger.
Exactly,
you can
guys.
shower
Yeah,
immediately. Obviously you'll be a bit groggy from the anesthesia.
Exactly,
but as soon as you wake up, you take your shower, you walk around.
There's no limitation,
No
actually.
limitation.
Exactly. So you can be able to shower immediately after your BBL, guys. Don't be scared, okay?
Yeah, don't be scared.
Exactly, you'll be fine, man. Now, on to the very interesting, touchy guys, question about these procedures. So this guy is asking, after how long can someone after BBL?
Interesting.
Yes.
I mean, I'm just trying to picture it. Like, what positions exactly are you assuming?
We've just talked about, a few sections ago, we've just talked about, not, putting pressure on the area of the bum bum.
Yeah, I think.
So, I mean, maybe
essentially that's the biggest problem. It's just the pressure on the bum bum.
Exactly.
Back to the imagination. I'm sorry, but like
it's crazy, guys.
Yeah, as long as there's no pressure on the bum bum. But I mean, resting time, healing time. We usually just recommend you heal for 6 weeks.
Yes.
Then after 6 weeks, I guess you could
be able to get back to
figure it out somehow.
Again, guys, it also depends on the position you assume. Just saying, food for thought. Take that into consideration.
Yes.
But don't put pressure. Remember, guys, let the tushy rest. Amazing.
So we have more questions. Are smokers eligible for a BBL?
I mean, guys, man, smoking, smoking has its own general health risks. Okay? Yeah, that's the first thing you need to appreciate. That if you smoke, not only will you have issues with the general healing of after your BBL, but you'll have general health risks regardless, okay? Yeah. And so, you see, what you need to appreciate when it comes to BBL and smoking is that gas, that smoke, the components of the cigarette naturally will, reduce the caliber of your blood vessels.
Yeah, that's true.
Now, when these blood vessels are reduced, you can imagine what's happening to the area where this blood was going.
Exactly.
They're not going to get any blood supply.
Yeah.
So, if you relate or take the same concept to a BBL or an after BBL procedure, the fat that you've put now is not going to have any blood supply. Therefore, we do not expect you to, be able to achieve the maximum results that you would have achieved were you not a smoker. However, because what they're going to ask.
If I smoke, I can't
that's
have
what
a
they're
BBL.
going to ask. That's what they're going to ask. And we're not limiting anyone to having a BBL if you're a smoker. Because we usually advise for a duration of about 2 weeks before the actual surgery. And that has been shown to be adequate for you to have good healing. However, guys, we still insist smoking affects your health.
Yeah.
Therefore, if you can, stop.
Just avoid it.
Exactly, man.
So essentially, you're not restricted. You can get a BBL. Just bear in mind your healing might be a bit different.
Exactly,
it might
guys.
take a bit longer than somebody who doesn't smoke.
Exactly.
But not restricted.
Exactly.
You can come for a BBL.
Come for BBL, guys.
Okay, so next question.
Yes.
Is a BBL scar visibly prominent?
Answer to that, guys, it's in most instances invisible. And the rationale is also again scientific, guys. It's amazingly scientific. Because remember, first we're making really tiny incisions.
Very tiny.
Then you're making these incisions along your skin creases, natural appearing skin creases.
Yes.
And that naturally helps to hide the scar, one. But two,
Yes.
even after the procedure, we do manage the scars with time, okay? So we do some serial changes of dressings. And even after that, we do some very amazing scar management
That's true.
to help the scar try and fade away. So in most instances, guys, the scar should not be visible.
Yeah, so you can go to the beach wear your tiniest bikini
Exactly,
and you'll
guys.
be fine.
And remember, guys, to do the squats. When they ask you, it was the squats.
It was the squats.
It was the squats.
Okay, so now let's talk about implants
Okay.
in relation to BBL.
First things first. Fat is the most preferred.
Yeah.
If you guys want to have a BBL with the best outcomes,
Yeah.
we prefer fat. Why? Because fat is from you. So even it's like taking something, it's like robbing Peter, not to pay Paul, but to pay Peter. Robbing Peter to pay Peter.
That's
okay?
true, actually,
Exactly.
yeah.
Or robbing Paul to pay Paul. You
Yeah,
know?
it's
So we're taking the
organic.
fat from you
Yeah.
and returning it back to you.
Yes.
Therefore, the chances of having any reaction, any type of immune
Yeah.
reaction is very minimal.
Yeah,
Yeah?
rejection is minimal.
That notwithstanding,
Yes.
there's some people who have a naturally small bust.
Yes.
For these people, we can't harvest enough fat for them to achieve the outcomes that they want.
Exactly.
We do advise for implants, and there are very many types of implants that they can come and get.
Yeah, that's
but of course,
true.
these implants have their limitation.
Yeah,
the
you know,
limiting
like you
factors.
have implants, they have the limitation of number one,
Exactly.
they could reject, and then also you can't have an implant for the rest of your life. At some
Exactly.
point, you need to take it out.
Exactly.
So after 10 years, you might have
Exactly,
to remove it and
guys.
have another one.
Exactly.
So I mean, if you have the fat, that is the best way to
That's
go.
the best.
But
man.
yeah, for tiny humans, I guess.
You're not limited, guys.
Yeah.
Let's get BBLs.
Okay, so next question. How, okay, this one's pretty interesting.
Ask.
How does one wipe immediately after BBL?
Guys.
Wipe what?
Interesting question though. Now, principally, appreciate that the incisions that we make are far away from your anal vag. Therefore, there shouldn't be any limitation in wiping, guys. Just wipe, guys. If after procedure and you want to go use the loo, wipe, guys. There is no contraindication, there's no limitation, because those incisions are very far from your anal vag.
Yeah.
Therefore, guys, there's no limitation.
So you're basically
At all.
saying I can just wipe.
You can wipe.
Same way I used to wipe.
You
before.
can wipe the same way you used to wipe. There is no, risks, nothing
Yeah.
as pertains wiping post BBL procedures.
Awesome,
Yes.
awesome. So that's the end of the questions for now.
Wait.
Yes.
I'm sure these guys want to know. I'm sure these guys want to know. Did you get a BBL?
Well, I mean, I am African contoured, baby.
Guys, African Contoured Podcast. Thank you so much for tuning in, guys. As usual, you can leave your comments down below. And for those guys who want to contact us, our contact numbers are also down below. We were your hosts, Dr. Thomas.
And Dr. Dlamini. Please don't forget to subscribe, and we will see you next time.
Bye, guys.
Toodles.